Next, let me welcome to the podium Dr. Bob Blouin, who is the Vaughn and Nancy Bryson Distinguished Professor and Dean of the UNC Eshelman School of Pharmacy. Dean Blouin's research interests include studying the effect of disease and altered physiological status on pharmacokinetics and pharmacodynamics of drugs. Dean Blouin has also led a national discussion on the issues of clinical pharmaceutical scientist training, particularly at the graduate level. He has been extensively involved in launching a transformation in the professional and graduate curricula at UNC, coined the Educational Renaissance. Dr. Blouin holds a doctorate of pharmacy from the University of Kentucky and did his residency at the University of Kentucky Medical Center. Dean Blouin, thank you very much for joining us today.
Thank you very much, Jim. It's a pleasure for me to be here today to share with you some of my thoughts on this particular situation. As I was thinking about my remarks, I thought that my remarks could be directed from a person who is a pharmacist, a pharmaceutical scientist, and a dean of a school of pharmacy. But I also reflected on my remarks from the perspective of a spouse, of a father, and a grandfather. And I started to ask myself the question, what do I expect of a medication? What can we expect of a medication? And as I reflect on that, we certainly want to make sure that the medication is going to be prescribed for the appropriate disease. And once that diagnosis is made, we all have a certain level of confidence in what is expected to be delivered when that patient receives that medication. If it's an injectable, we expect that drug to be sterile. If it is an oral dosage form, we expect certain things to take place when a person ingests it, whether it be in the form of a solution, a suspension, a capsule, or a tablet. We expect that tablet to undergo appropriate disintegration, appropriate dissolution, and we expect the time course of that drug, once it enters into the circulation, to exhibit a certain pharmacologic response. And now, after 4 decades of application of many of these principles, when generic drugs were introduced, we as a society had an expectation that even a generic compound, when administered to a patient, would mimic pharmaceutically in a bioequivalent fashion to that of the brand. Now, as we reflect on the problem of today, can we be assured that such a delivery system is there for every patient in this world? We in the United States take great pride in the system that we have to protect the delivery of medications to patients. And despite that sophisticated infrastructure, we still find that patients are receiving falsified drugs, mainly, as Dr. Reimer mentioned, due to the use of the internet and receiving medications that have not been properly validated. When you look now at the global environment and you now see the magnitude of this problem, it is daunting. So in the United States, less than 1% of patients probably receive a falsified drug. In preparation for this symposium, I discovered that at a global level, the numbers are horrific. And as bad as those numbers are, I think they are understating the problem. And so how can we assure that every patient globally is going to receive the right dose and have that formulation be administered in the appropriate way? People in industrialized countries might feel that this is not a big problem. But I can assure them that this is a problem for all of us. Because not only is that patient in Southeast Asia or in Africa potentially not receiving the active ingredient at a rate that is really scary for all of us to contemplate. But what if that patient is receiving a dose of that drug that is suboptimal? And this is going to create an additional problem for us globally. Not only will that patient be inadequately treated, that patient is now harvesting what might be the superbug of the future. And these microorganisms are not staying still while we are inventing new drugs and new treatment paradigms in order to eradicate them. They are genetically re-engineering themselves. And we know that with suboptimal therapy, we may be creating an environment for all of us to have to deal with, irrespective of where you live. And so it's just so appropriate that this week we have this meeting to bring attention to this problem at the local, regional, national, and global level. And for all of us, and the many scientists who will be speaking here today, are committed to making sure that every patient, regardless of where you live or how much money that you have, that you will be assured that the right medication, the right dose, the right rate of administration of that dose, and the right absolute bioavailability of that medication is going into your system to eradicate that infection. And so it is my pleasure to be a part of this day. On behalf of all of the faculty, the staff, and the students of the UNC Eshelman School of Pharmacy, it's a pleasure to be a part of this effort. Thank you very much.